Sustainability. Nobody wants to build or modernize a school or hospital and then watch it fall into disrepair and disuse because the local economy is simply unable to pay what it takes to keep a modern facility running and maintained. So sustainability is the holy grail of charitable projects. Colleges and universities are expensive to operate, and high as they are, the fees don't pay what is needed to keep most schools going. Apart from government subsidies and grants, they have found that large permanent endowments are a key resource. We all know that because we get asked for donations to the endowments of our alma maters. So why not establish a permanent endowment for a hospital or school in a poor country to help pay the operating costs indefinitely, as long as the principal is preserved and continues to generate earnings? Surprisingly, we have not seen this done, at least not in sub-Saharan Africa, where we find the greatest need. Well, perhaps it's not so surprising when you consider how hard it is to get people to donate to some future gain instead of for the immediate needs of war refugees, starving orphans, and abused women that we hear so much about. Segue now to the Democratic Republic of the Congo, one of the poorest and most war-torn countries in the world, and find there, in the province of Central Kasai, a 160-bed teaching hospital and medical education complex called IMCK, Institut Médical Chrétien du Kasai, or Kasai Christian Medical Institute. It is recognized by the government and the population as the leading such medical facility in central Congo. It draws patients, college-level nursing school students, 60% of them young women, and male and female medical interns and residents from all over the Congo. The government sends its own employees to IMCK's Good Shepherd Hospital for their health care and uses it as the hub of its public health system in the region. IMCK provides a level and quality of health care and education unmatched for 700 miles. But it struggles to pay salaries, buy medical supplies, and maintain its modern equipment and buildings because the local people are simply unable to pay fees as high as needed for such an operation. In fact, IMCK routinely uses precious resources to treat hundreds of desperately ill but impoverished charity patients every year, not to mention those wounded in the local conflicts arising from poor governance and corruption. And so an organization called Friends of IMCK has been formed to raise a permanent endowment for that institution. Almost $450,000 has been raised to date and is being carefully invested by the reputable Medical Benevolence Foundation in Houston, Texas. This principle will be protected here in the United States, but when the initial target of $2 million is reached, the earnings from this trust fund will start to be dispersed to IMCK for use in whatever their local management team determines are the operating expenses most in need of support. IMCK is audited annually. It has a modern computerized accounting system, and it is under the firm control of an independent board of directors. All donations to this endowment are fully tax deductible. So why not make your charitable donation one which keeps on giving year after year? Would you consider donating $500 to pay for fistula operations for 2 abused women, or to feed a malnourished orphan for a year, or to pay the annual school fees for 2 promising young nursing students. At current rates of return, even with the fluctuating markets of the past year, this endowment has gained more than 5% in value annually. Assuming an annual disbursement of 5% of principal, consider that a one-time donation of $10,000 would provide that same $500, not just once, but every single year for as long as the people of the Congo continue to need the services of this institute. In other words, indefinitely. Now that would be an investment indeed. The IMCK has demonstrated what quality health care and education can mean in the heart of Africa. Now help us to use IMCK to demonstrate a new funding technique for Africa that provides self-sufficiency and sustainability while delivering top-quality care and education. Consider setting up a memorial fund for a loved one, or in honor of someone that you or your community wishes to recognize who has a heart for Africa, and make it a named part of this endowment. Since the endowment itself is permanent and ongoing, your memorial will also be a lasting tribute. Or you could make this endowment one of the beneficiaries in your will, trust, or IRA, and thereby make a much more significant gift than might be possible while you still need to live on your savings. Family always comes first, of course, but even so, there may be ways to devote significant resources to a wonderful charity opportunity such as this, without sacrificing family obligations. Consult your own financial advisor and legal counsel for possibilities. And you can help talk this up with your friends on Facebook or other social media and face-to-face. Tell them what a terrific opportunity this is and help it to go viral. Whatever you are able to do, whether it is large or small, one time or repeated, know that the people of the Congo will deeply appreciate and hugely benefit from your generosity.